She comes in. All right. Okay, we are good to go. All right. I trust that our weekend has been good. So we're just going to go right into it. Thank you everybody for coming around. We're coming to talk about our health and something that stresses literally almost everybody here. Hi. All right. Let's just pray. Our Father in heaven, thank you, Father, for today's meeting. We ask God that as we learn, as we have conversations, that they will be impactful and we would receive solutions to questions and things bothering us. In Jesus' name, amen. All right, our
Amen.
doctor is in the house. Doctor, you have the floor.
Okay, good evening, Queens. My name is Victoria. Yes, I'm the doctor she's speaking about. Can you hear me, please?
Hi, you're the doctor now. Yes, we can hear you.
Okay. Good evening,
You're
everyone.
the doctor now.
Good
Good
evening.
evening.
My name is Victoria, like I earlier said. So basically, today we're going to just be talking about periods. So everybody can you can ask questions once the speakers are done speaking, jot down things because there are a lot of things that a lot of females don't really know concerning their periods, So um before we start, I think is Nostenia on the call, please? Okay.
Hi, yes, good evening.
On the call. Okay, so I'll just give the floor to her now. Let her just. Okay, so Nosteni, please take over.
Hi, everybody, good evening. So, our topic today is basically about periods, and I'll take the first part, and I'm going to be talking about a period and then what is normal and what is not normal in the period. So basically, if what's the period? A period is called menstruation, and it is a monthly shedding of uterine lining when pregnancy does not occur, and it's a normal thing for every lady of reproductive age, and it is a part of the menstrual cycle. And periods start anywhere from the age of 8 to 15 in every woman. So I'm going to start with what is considered normal in period. So the cycle length is usually between 21 to 35 days in adults, and teenagers might have slightly irregular cycles in the first few years. So like girls within the ages of 8 to 13 might have irregular periods. Like it might not see it January and then probably see it in February. It's normal in the first like 2 3 years. Then duration of bleeding for every period should be between 3 to 7 days. And then the flow should be light to moderate. So if and there's this notion that people have that when you're on your period, you lose a lot of blood, and that is not true at all. Normal blood loss during a period is between 30 to 40 mils of blood, and that's like 2 to 3 tablespoons of blood. And even though it might not look like more, that is like per let's say per day. Overall, like you say, like 100 mils of blood, like the entire 7 days. Then also normal symptoms that can occur during a period. You have lower abdominal cramps. This is everybody calls it menstrual cramps. Then there's also breast tenderness. Like some people tend to be very tender in their breast during the period, and some people's own can be very bad, and some people don't even have it at all. Then there's also slight mood changes. Some people tend to have mood swings from like days leading to their periods and like during the period itself. Then there's mild back pain, and some people also experience fatigue. So now I'm going to talk about what is not normal for a period. So now, why when they say things that are not normal during the period, some people experience this thing, but because they have had it for years, they're just like, oh, that's just how mine occurs, like it's normal to me, but it's actually not normal. And these are things that should be, observed and like taken to the doctor for better care. So first one I have here is bleeding longer than 7 days. Once your period is moving past 7 to 8 days, moving past and then occurring on the 10th day, 11th day, that is no longer normal and you have to seek help. Then soaking a pad or a tampon every 1 to 2 hours. Now, this one, some people be like, oh, I just have very heavy flow. I just have very heavy flow, and that is not normal at all. Your pad should not be soaked until like maybe like after 4 hours. Which that 4 hours is pushing it, but yeah, 4 hours. Then passing very large clots frequently. This large clot, I've heard a patient say that oh, when she passes this clot, she feels dizzy, but then it's just normal for her, like it's just a normal thing, but it is actually not normal, and the doctor had to tell her that. Then severe pain that stops you from going to school or work. So if you experience menstrual cramps that makes it difficult to go about your day-to-day activities, then that is not normal. Then also bleeding in between periods. Now, only except okay, exceeding the time, let's say you're on medications that is going to cause you to bleed in between periods. Bleeding in between periods is not normal. Like bleeding every 10 days. Some people will say, oh, I get my period twice in a month, and that is not normal in any way. Then missing periods when you're not pregnant. I know that earlier I said that in teenagers they might have irregular periods. So that's by the way. But if you're like a woman of within the ages of like 15, 16, and you're missing periods, it can be an indication of PCOS, hormonal and other like hormonal imbalances and all that, and that is not normal. Then periods just stopping suddenly, like let's say it just flows like 1 2 days and then it just stops. It's not coming out. Like you're not seeing it anymore. No, no sign. It just stops. That is not normal. And this topic matters because a lot of girls think that painful periods and heavy periods are normal and they are not. And the cultural silence among the cultural silence among menstruation, like I know that here in Nigeria, periods are a shameful topic to a lot of people. So it leads to misinformation and understanding your cycle just helps to detect any health problems, helps to care for yourself better, and it increases confidence in body awareness. So I'm going to pass this on to the next speaker. Thank you.
Oh, thank you so much, Nosteni, for your insights. Thank you so much. I would like to call Esther now to the floor. Esther, are you on the call?
Yes, good evening. Good evening, guys, queens. I trust we're well. Okay, so I'll be talking about cramps. I'm sure many of us can relate. Cramps are menstrual cramps basically are lower belly pains that happen before or during a girl's period, and they usually happen because the uterus or the womb is a muscle, and every month it squeezes or contracts to push out the lining that comes out as period blood, basically. So that squeezing that we usually feel from time to time, that's what we call cramps. All right. And some girls, they usually feel it as a dull aching, a very tight squeezing, lower back or waist pain, and pain in the thighs. And some people, they experience everything, like all four kinds of pains. So and cramps, they're usually they could range from mild to very severe cramps, and very severe cramps usually happen when you have people that usually have conditions like endometriosis or uterine fibroids most times, right? So usually if your cramps are usually very severe, you need to see a gynecologist to get checked and to be sure that you are not experiencing any of these conditions. So how do you handle cramps, and basic self-care tips for handling cramps as a lady? So one of the major self-care tips that helps to handle cramps during periods is heat therapy. And how does it work? Heat helps to relax the warm muscles, and it improves blood flow, and it reduces the pain signals that goes towards that area. Think of it like, for example, maybe when you make your hair, they usually use hot water to like press your scalp to reduce the tension, to reduce the pain. So it's kind of like the same thing that happens when you make use of anything hot. So how to use this heat therapy safely? You can use hot water bottles or heating pads. You can place it on your lower tummy, and you can use it for about 15 to 20 minutes. And make sure it is very warm and it's not burning, so that you don't burn your skin. And from time to time, you can usually use like a cloth before you use the hot water bottle or the heating pad, so that the heat effect doesn't maybe burn your skin or put too much pressure on your skin. And you can repeat this few times a day, so that it calms the muscles around the pelvic area, that is your hip and the region where, and your lower abdomen basically. Then you can have a warm bath. You can sit in warm water for 15 to 30 minutes, and it helps the whole body relax, and it is really good for cramps, especially with people that usually have lower back pain. It helps a lot, like it gives you relief very fast. Then you can use warm towels. You can dip the towel in warm water, you squeeze or you wring it, then you place around your abdomen like you are just dabbing, or you allow it stay for a few minutes, put it back in the warm water, wring again, then continue till you feel a little sense of relief. Then another thing you can do is light movements or stretching. Most girls feel like when they have cramps they should be in bed all day, and this truth is that when you're in bed all day, there is less blood circulation, so it even makes the cramps a bit more painful. So but if you move, like if you take short walks, maybe you move around a little bit in your room, or you take a walk in your compound, not something too intense, because at the same time too, you shouldn't be stressed during your period. So you can take short walks, and it helps to improve blood circulation. It reduces the stress hormone that is already being secreted from your body, and it helps the release of endorphins. Endorphins are natural painkillers that are released in the body during that period. So endorphins are like your body's own way of calming that entire area. So taking a 10 to 15 minutes walk will help the release of these endorphins, and it will help the complete blood circulation in your body. Then another thing you can do is hydration. When you are dehydrated, the muscle cramps more easily, and blood flow becomes less efficient. So when you are drinking enough water, that is when you are very hydrated, it helps your muscle function properly. It reduces bloating, that is um that feeling that you like usually have when you are extremely full, that kind of swelling in your tummy, that very uncomfortable kind of swelling, that is bloating. So it will help reduce bloating, and of course it supports circulation in the blood, because the blood is a cell, and for cells to move properly within for blood cells to move properly within your body, it needs enough water. So you should be properly hydrated during your periods. Then another thing you should take note of is balanced diet. Balanced diet. Ensure that you reduce sugar intake or junk food, because too much sugar increases inflammation, it worsens your hormonal imbalance, and it can even make cramps stronger, because you are producing more insulin, and it causes inflammation from time to time. So to reduce the cramps, you need to eat more food that is rich in magnesium, because magnesium helps muscles relax a bit more. So you can take foods like bananas, nuts, leafy vegetables, and you can take foods that are rich in iron, because during your period you lose blood, and blood contains iron. So if you don't eat enough iron rich foods, you may feel very weak, very tired, and dizzy during your period, especially people who have heavy blood flows. So you can eat foods like meat, fish, beans. Then you take fruits, which are very rich in vitamins, and these vitamins help in iron absorption. So taking all of these can help your body regulate properly during that period, and it can help you reduce cramps. So fruits like oranges and even lemon water, or teas like ginger tea, green tea, can also help reduce your cramps. Then another thing you need to take note of to help reduce cramps is rest and sleep. When you lack sleep, your stress hormones increase, your pain feels a lot more stronger, your body doesn't even repair well, because you are you are overstraining the body at that time. So sleep helps you regulate your hormones and reduce pain sensitivity. So basically, a tired body would usually feel pain more than a body that is strong and more relaxed. So you need to relax a bit more when you are on your periods. Then stress reduction. Stress usually increases a lot more during your period, because stress hormones are released like cortisol. The muscles are tense because they are contracting from time to time, and there is inflammation from time to time, which also leads to bloating. So how to go about the stress reduction? You can take deep breaths, take short walks, you can play relaxing music, you can meditate, not thinking too deeply, because anxiety can also stress you a lot. So we're talking about meditation, so something calm, something soft. Then as well, prayer helps. I mean, this is a Christian community, so prayer helps a lot, because there are times when the pain can be so intense that you cannot even it can just be a lot, basically. So prayer can also help. For example, yesterday I was having serious cramps. I was even telling Mama Tobes, and I honestly took out time to pray, listen to music, and just relax, and I felt better after a while. So it really helps. It helps you calm the nervous system, it reduces muscle tension, and it also reduces, like, it causes lower pain perception. So a calm mind helps your body to also stay calm. So basically, those are the various ways you can manage your cramps during that period. And you can also make use of pain reliefs, but that should be based on doctor's prescription. Do not self-medicate. If you need to use pain reliefs, you can always ask your doctor or ask a medical professional before going ahead. Thank you so much.
Wow, thank you so much, Esther. Thank you so much. Okay, so I'll be taking up discussing about your cycle. I know a lot of females are not really aware of their cycle length or how to track their periods. And it's super important. And like I can give you like different reasons why it's important. Because one, you want to make sure that your cycle length in itself is completely normal. you know you also want to make sure that you are seeing your periods every month, not just because of pregnancy, but because not seeing your periods or missing your periods could be literally a danger sign, right? The normal cycle length in a female, an adult female, is between 21 to 35 days. So essentially what that means is, with an average of 28 days, what that means is that if a female sees her period on the 1st of March, it's most likely that this female will see her period on the 1st of April. So when she doesn't see her period on 1st of April, you can now say, oh, if she sees her period on the 1st of April, we can now say, okay, maybe she has like a 28 to 30-day cycle, right? Now, if it now passes beyond this, or you have been seeing your period regularly every 28 days, and then you now notice, oh, wow, no, I'm not seeing my period again, no, or my period is now coming on the 37th day, right? It now gives an alarm and says, oh no, something definitely is going wrong, right? So yeah, so it's important to note that. It's also very, very important for females that do not write down their period dates, right? It's important for them to have period calendars. If you go on Google Play or you go on Apple Store, you have period calendars that you can download that are free, right? These period calendars are not only for imputing your periods, they're also meant to impute, they're also used to impute your emotions on different days of the week or different times of the month, because it also helps you track premenstrual syndrome, which I'm sure somebody else will talk about later. So it's very important. It also helps to know, okay, when am I ovulating? Because you have a lot of females that come in and say, oh wow, I'm seeing a vaginal discharge. But guess what? It's not vaginal discharge, it's actually ovulation that is happening. So just quickly run down, it's important to know, okay, like I said, an average female menstruates, her menstrual cycle length is 28 days. So the first 5 days, day 1 to day 5, is when the female actually sees her period, right? So some people, I'm sure they see their periods for 3 days, some see their periods for 5 days. Anything greater or less than is a problem, right? So just pointing that out. Then day 6 to 14 is basically when your body is preparing for ovulation. So this might be the period where you notice, oh, you're having breast pain or breast fullness, because at this point in time, your estrogen levels rise. It might also be the point where you notice that you're having, let's say, you're having change in emotions, and then day 14 to 17 is the point of ovulation. That's the time where you see maybe a discharge. It looks whitish. It literally doesn't have any smell. It can happen, how do I explain that? It can happen on one single day. In some females, they may see it on 2 different days. Because although ovulation means release of 1 egg, some females do release 2 eggs per month. It happens. That one is completely normal, right? Then from day 8 to 28, from day 18, to 28, is now when, okay, you have ovulated, but guess what? Pregnancy did not occur, right? But because you have ovulated, ovulation basically means, oh, my body is producing an egg, right? In preparation for maybe conception, right? But conception doesn't happen, right? And if conception doesn't happen, while that egg is being produced, your uterus still will tell your body, okay, no, let's also arrange the uterine lining, right, in case conception happens, so that the baby can be able to implant, right? If that doesn't happen, your uterus will then shed juicing, and then when it now shed, that's what you now see as day 1 to 5 menstruation, right? So please, I don't know, at the end of this call, I want everybody to please show us evidence that they've downloaded their period calendar. It's super important. Like, I can't stress it enough. You can't, for every female of reproductive age, once you go to the hospital with different symptoms, your doctor would ask you, when was your last menstrual period? It's important to have an answer, because different things are related to your periods. Now, let me discuss on that. For example, one, you see females that come in with acne. Your acne is related to your cycle length. It's related to the amount of days you see your period. It's related to you not even seeing your period. Different disease conditions are related to not seeing your period and also having acne, right? Like the PCOS that Esther just spoke about, right? Or females that, then there are other things that you can also see that come with periods. There are different things that you can see that come with your period. Things we state to be period problems that a lot of females think, oh, it's normal. For example, having diarrhea or constipation is not normal in your period. I can't stress this enough. It is not normal. It usually happens because there's irritation of the womb. The womb is very, very close to the rectum and very, very close to the bladder. So you see females during these periods, they are maybe urinating excessively, or they are stooling, or they are just not even or they are just not even having bowel movements. This is not normal. Or during your periods, or you're having anxiety, it's not normal. Having nausea is not normal. In fact, there's this very interesting one. It's called menstrual migraines. It usually happens during the times of your period. You just notice that you're just having really, really intense headaches. And it's important to go to the doctor during these times, mostly because there are medications for these things. There are medications that actually do prevent these things. Or females that they change, like Nurse Tenny said, that they change their pads up to 4 times, 3 times in a day, and these pads are soaked or they are passing large clots. This is not normal, and you must see a gynecologist. Or females that you notice that, okay, I've seen my period today, I ended it maybe, I saw my period last week, I ended it today, and then in 5 days, I'm seeing my period again. Now, there's something I need to really point out while discussing this. There's a difference between seeing your period and having spotting. So there's some certain females that maybe say, let's say they saw their period for 5 days, and then on a random day, let's say 10 days after seeing their period, they now saw some light pink, you know, pink, some light pink discharge that maybe does look like period, but it is not period, it is spotting, right? But if you are not very sure that, oh, this is spotting, you can then go to your maybe gynecologist or your GP to complain. Now, spotting basically occurs because, let's say, for example, there are hormonal changes that occur in your body, or sometimes females during ovulation do spots. Now, something I want to point about ovulation is there's some women you hear them say, "Oh wow, it's not just my period that I have pain. Oh, when I'm ovulating, I have pain. Every day of my cycle I have pain." It is also not normal to ovulate, to have pain while ovulating, please. So please, if you are on this call and you're going through any of these things, or you have any friend that is going through any of these things, I will highly suggest that you do go to a hospital, see a GP or see a gynecologist. There are medications for these things. In fact, some of them are related to certain disease conditions that you may not know about. So yes. So I'll give the floor now to um I'll give the floor now to Nurse Tenny. She's going to be discussing more on this.
Hi, everybody. Hi, once again. So I'm going to be talking about period products. I'm going to talk about period care products and um, sustainable options, period-friendly products and sustainable options. So I have a couple of them listed here. And the first one, I'm going to start with general ones that everybody knows, sanitary pads. And so sanitary pads are worn externally. And I think a lot of us are familiar with sanitary pads. They are easy to use and they are very good for beginners, especially for teenagers that are just starting out. And for care, sanitary pads should be changed every 4 to 6 hours. This is just um prevent infection and all that. And for better convenience, sanitary pads are available in different absorbencies. Like we have light flow, regular flow, heavy flow, and even we have overnight pads. I think all of us there was a time that higher pads were trending, and that's because they actually do the jobs of keeping the period leak free. They do them really well. Then we also have. So I'm going to be like listing the pros and cons of each sanitary product. So pros for of sanitary pads, they are very comfortable, no internal insertion, and it's very easy to access. There are pads everywhere. There are different brands available. But the cons is it can feel very bulky. Some people have said they don't like how sanitary pads fit against their skin. Sometimes, depending on what you're wearing, it shows up under say, like light pants, trousers, and all that. Then it can also cause rashes if not changed often. In fact, some brands that are available right now, they are not properly done and they can cause rashes for women. And then another product I have listed here is tampons. So tampons are inserted into the vagina to absorb blood internally, and it should be changed every 48 hours. But for tampons now in Nigeria, I'm gonna say I don't know. I'm not gonna say everybody, but like a lot of people do not use tampons, and there's this stigma. Like from what I've gathered, there's this stigma about tampons. It's like, oh, if you're using a tampon, that means you're not a virgin. Or if you're using a tampon, you're sexually wayward, and it doesn't even work that way. Abroad, even teenagers use tampons. And this is just to remove the shame of maybe using pads. You don't want to say you're using pads, and it is really great for people that are athletic and people that swim. So now the pros of tampons, or even already mentioned it, people that are athletic can use tampons. You cannot use a pad if you're a swimmer or if you have a race, you are an athlete. You cannot use pads. Then it's also very discreet. That's why I said some people don't like the bulky look of pads and they can just go for tampons instead. It's very discreet. But then the cons, and this cons is a very, very big issue concerning tampons. It has the high risk of toxic shock syndrome if it is left too long. Now, I've read stories of women saying, "Oh, I used the tampon and I forgot to take it out, and then he got infected and they went into shock." And this is a very, very big risk. Inserting something into yourself and then forgetting it there is a risk that should not be taken. If you know that okay, you cannot be accountable for this kind of products, then I feel like tampons should not be an option for you. And if you're using tampons, it requires proper hygiene. You have to wash your hands when you're inserting. You have to wash your hands when you're taking it out just to prevent infection. Then another product is menstrual cups. Now this is menstrual cups are more popular among women. Let's say like higher like women women within the age range of let's say like 30 to 40. And menstrual cups are reusable silicone cups that inserted into the vagina. So I don't know if we've seen the cups before, but like they're really, really foldable and it's easy to insert. And it just collects the blood instead of absorbing it, and it can last up to 10 years. Like you can use one cup for up to 10 years, provided you're sanitizing it, you're washing it properly, you're storing properly. And so I'm going to list the pros and the cons. So pros, it is cost effective in the long term. Like I said, you can use one menstrual cup for up to 10 years, and it's environmental friendly. You know, you don't have to throw them away like pads. Like most pads are not biodegradable. They're not biodegradable. In fact, most pads I've seen places where they're burning pads and then it's not even burning. Like that's how bad some pads can be. But menstrual cups, they are better for the environment long term, and then it holds more blood than tampons. Then the cons, learning curve for insertion and removal. So I watched the TikTok video on this menstrual cup a while ago, and then she was like, okay, when she was bringing out the menstrual cup, it slipped from her hand, and then the blood splashed everywhere, and it looks like it's trying to. And she was really, really going on about it. So like that's a con. If you're removing and you don't properly handle it, it can spill everywhere, and nobody wants to be wiping up blood. Then there's also need for proper sterilization. If you're using something that goes inside of you repeatedly, you have to properly clean it and sterilize and store it properly. Now another menstrual product is reusable cloth pads. These reusable cloth pads are washable and reusable. I will not say they're really popular because I have not seen any myself, but they are popular among people in smaller communities that cannot afford pads consistently. So it is eco-friendly and it saves cost over time. Now we now have like sustainable and modern options. Now these are options that they are not traditional options like pads and tampons. Then we have so this one we have period underwear. There are some panties that now come very heavily padded. In my opinion, they are same thing as reusable cloth pads because you just wash them and reuse them, sterilize them. Then the organic cotton products and biodegradable pads now. So I'm gonna give hygiene tips for these menstrual products. So first thing is we have to wash our hands before and after changing the product. You have to wash your hands. This is to prevent any type of infections. And then you have to change pads and tampons regularly to prevent breeding of bacteria. Because you have to keep in mind that wherever is warm and slightly wet and dark is going to breed bacteria. So we have to avoid that as ladies. Then we have to avoid scented products. I remember when I was in secondary school, there was this high praise of always pads. I always had used a product heavily perfumed, that was heavily perfumed, and everybody wanted to have it at the time. And even me, I had it too. And in the long run, it turned out it was bad for us because it was heavily perfumed. And everybody would be like, "Oh, if you use it, you will not smell anything." But that is not good for us as ladies. And all these vaginal washes that are heavily perfumed, so should not be used. Then you also have to store your products in a clean and dry place where it's not going to be where you're not going to come in contact with water and breed bacteria. So now, like one very important point I'd like to make is that there is no best product like for menstrual hygiene. There's no best product. Everybody has to use what works for them. If it is pad that works for you, that's fine. If it's tampons that work for you, that's fine. What is the most important? The most important thing is your comfort, your hygiene, how accessible it is to you. Are you in an area where you cannot get tampons, but you can get pads there? That is you should fix what is accessible to you and the cost, what you can afford. If you can buy one menstrual cup and use it for the next 5 years, that's good enough. Just to what works best. Thank you. So I'm gonna be handing over to the next person.
Thank you very much. Thank you so much, Nurse Tenny. So I'll be calling on Tosin. Tosin to please give us more.
Good evening. Thank you, everyone, for staying for over 40 minutes listening about period health. So, I'm going to be talking about oral signs and mood swings and emotional support. So, I'm going to be mentioning something that is going to sound a bit scary, but I'm assuring you that it's just a big name and it's something that is not scary at all. I'll be talking about menstrual gingivitis. Like I said, the name sounds big, it sounds scary, but I can assure you that it is nothing. It is nothing. It's just a symptom. It's just a symptom. So, gingivitis basically is inflammation of the gums. So, during your period, just as there's increased blood flow to every other area of your body, there is also increased blood flow to your mouth. So, what happens in that period is that okay, this period is usually around um the time before your period and the period itself. So that's like, I want to try and use the specific terms that will not be too confusing, just as Dr. Victoria has mentioned. So you see from like day 27 to day 7, your prostrogen and estrogen levels begins to I say, what am I saying? Sorry, it's from that day 14. Sorry, that's like from the luteal phase around that area. Your estrogen and progesterone level are quite high, so that's when there's increased blood flow. So there's increased blood flow to the gum, and then the gum becomes swollen. So you notice that the period, the time before your menstruation, the time before your period, and during your period, your gums are swollen and a bit irritated. And when you try to brush, there's a bit of bleeding. You shouldn't be worried. It is normal. It is normal. So when you go to the dentist and they ask you about your period, I know you are wondering that why is the dentist asking me about my period? What do they want my period to do? We don't want you to do anything. We just want to know because your oral health is also linked to your period in a way. So during this period, you're going to want to not brush. Like your body will be telling you that don't brush because if you brush, you're going to bleed. I want to assure you that you should brush, and you should even brush well. You should brush better than when you're not on your period, because okay, when your gums are inflamed, when they are swollen in that sense, it gives like room for bacteria to grow better. It's like I mean, imagine now there's a lot of blood, yeah, it's a juicy environment. So bacteria, they have more nutrients to grow better. So you're supposed to even take your oral hygiene better in that instance. And also there's also the period where you're also beginning to crave sugary things. You know, when your estrogen and progesterone levels drop during your period and a little bit after your period, you're beginning to crave like sugary things. You want to take a lot of sugary things. Don't do it. Don't do it. I'm begging you, don't do it. Um, the more sugary things you take, not only does it affect your cycle, it also affects your oral health too. Like I said, there's increased blood flow in that area. Bacteria are very excited, and now you're now like making the environment even better by increasing your sugary intake. And it's not as if when you finish eating the chocolate, you go and brush immediately. No, you don't. Let's not lie, you don't. You sit down on your bed and then you watch a very nice romantic movie. So you don't brush immediately. So like I said, you're giving bacteria a better environment to thrive. So instead, don't take sugary things. Try to avoid it as much as possible, and then brush. Like to make sure you take your oral health very seriously during that period. That's all you need to do. So the only time that you should be worried is when after your period, you notice that your inflamed gums, they don't go down, and throughout the rest of the month, it is still inflamed. At that point, you should visit your dentist. So I'll be talking about mood swings and emotional support. So I think you're not crazy that your mood is changing. I mean, there's like a proper definition for mood in medicine. It's called a sustained emotional state. That's mood. So now mood swing is when you can no longer sustain an emotional state. So you're constantly switching from happy to sad to angry to irritable. It is not abnormal. with the dropping, just like how for a man, testosterone is like what gives them drive. For a woman, what gives you drive is your estrogen and your progesterone. So when they begin to drop during your period, when your estrogen and progesterone levels begin to drop, it is normal for your mood to be shaky, because what sustains your mood normally is fluctuating. So it is normal for your mood to be shaky. So what do you do during this period? One thing that my mom always says the best medicine is to sleep. Firstly, I think it's very important that you should rest. At that moment, I don't think you should be doing serious activity. Just like I think it was Mosteni that mentioned that even though um, you're supposed to be active, don't be overactive that you're stressing yourself the more. That is also not good for you. Just a little bit of walking around is okay. I don't think you should be lifting weights and running. I really don't think it's going to help you in that period, because you're already on your period. For me, I find menstruation to be very annoying. I don't know. I find it very annoying. Just like the fact that I'm going to be changing pad annoys me already. So that's already is already adding to your mood. So you don't want to be adding anything that is going to stress you the more in that period. So how do you now like regulate your emotions? So firstly, I think you should anticipate that there is going to be a mood swing. And then you do not want this mood swing to affect people that are around you. You're trying to not allow just a slight imbalance of your hormones to not affect all your relationships. So what do you do? Like I said, you sleep. And what I do, and what a lot of Christian ladies that I've talked to also do, is that they use that period as an alone time with God. Open your Bible, pick a Bible character. You can pick Queen Esther, and now decide to strengthen your faith in that period. Study a character and watch a movie. Use that time that you don't want to be too active to catch up on a little series that you have read. And if you're a medical student, you have left your neuroanatomy on read for quite a while. You should probably open neuroanatomy again. Because when you go for ward rounds, the consultant is going to ask you a question in neurology and you will not be able to answer it. So you should probably open it again. And I think that is all I have to say about this. I hope I was able to teach you something new. And I hope that if you have any questions, you can always reach out. Thank you.
Thank you so much. Thank you so much for that, Tosin. I don't know. Does anyone have any questions? I have a few questions here with me. Does anybody have any questions? You can send it in the chat box. You can unmute. Okay, so while we wait for people to have questions. So I have a question for Nurse Tenny, right? My name is AO. I noticed that during my periods, I don't just have pain in my stomach, I also have at my back. Is this normal, please?
Okay, so thank you for your question. So earlier I said that symptoms that happen that you observe during period is mild back pain. You're gonna have mild back pain. But if it is very bad, bad to the point where you're having to take ibuprofen or you cannot walk, and that's not normal. You have to see the gynecologist or doctor for care.
Okay, thank you so much. If Oma may, please, you can go ahead and speak.
Okay, good evening, everybody. I'm so glad I joined. Okay, so I usually have period pain, but for I think since I was 10 years, 12 years old, because that's when it started, 2006, and up till when I was 31, I still have pain due to hormonal imbalance. So that pain that comes to the thigh, it's that pain that looks like a referred pain that goes to the knee and the back. What causes it, and how can it be stopped, or how can it be managed, since hormonal imbalance I know is the cause? How can I manage it more? But 2 months now, since January, I've not been having that pain since I got married. It's not as much, but there's still period pain. So how do I manage it? I want period pain to be gone completely, honestly, because I've suffered it all my life, all my adult, all my little teenage age till adult age. I don't want to have to suffer it till I have children. I want it gone. Yeah, that's what I want to ask. Hello, did you get my question?
Yes, I did. Thank you so much
Okay.
for that question, Mrs. Ifoma. So first of all, I would just like to say that it is not normal. That's the first thing. But we need to also note that the female pelvis is very interesting, right? Same way you have the womb, you also have nerves around that area, right? So any slight irritation can present in any way. The same way I just spoke about the fact that there's some females that either stool or they have constipation during their periods. There are also some females that do have pain that radiates down because of the nerves that supply the anterior thigh muscles are located in that same pelvis. So females that their wombs, how do I explain it? To be less medical. So females, so there are different positions of the uterus in the pelvis. Some females have their uterus more lower and some have it more anterior and upper. That's the easiest way I can say it for it to be understood. So depending on that as well, you would then have symptoms like pain radiating down your thighs. In fact, there are some females that tell you that they have this thing where even when they want to go and use the bathroom, they notice that there's this sharp pain in the anus that they just have to wait for a bit, right? And then when it relaxes, then they can now continue whatever they are doing. But yeah, so in that case, I'm sure it has pretty much reduced because of, well, as you've gotten married, right? There has been more, how do I say this? Yes, has it's got yeah, as you've gotten married, there's more, like you and your husband have been able to then meet. So it also sort of like also helps. So I'm probably sure that that's probably why you're seeing a reduction. So I would really also advise that you do see a gynecologist for this. There are medications that they give that help to reduce this pain around the time that you're having your period. So same with painful periods, right? You're not going to take the medications every day of your cycle. Just during your period cycle and just before, they will give you some certain medications. You take it, you notice that your period goes normally. You will not even know that you're in a period, except the fact that you're changing your pads. So I hope I've been able to answer your question, Mrs. Ifoma.
Yes, please. Thank you so much. Thank you. I'm so glad. Thank you. Thank you.
You're
It's sort of a
welcome.
relief. Thank you.
Cool. Okay, so I have another question. And this question is also for Nurse Tenny. So, I'm a 16-year-old girl. I noticed that regardless of how I wear my pads, I am having leaks, even though my pads are not full. What can I do? Nurse Tenny, do you get
Okay,
that, please?
so
Okay.
yeah, I do. Thank you. So thank you for your question. What I'm going to say is that as a teenager, I also experienced that. And I think like being in a situation where I was in a boarding school, I got to learn more about this. So what I'm going to say is that a lot of things contribute. Either if you're on the bigger side, like plus size, you're not wearing the right size of pads, that's one, or you're not using the right size of underwear for your period. You need to be very, very comfortable. And if your period is too big, if your panties are too big or too small, it's gonna allow the pad to not sit properly. Then I would also advise that you watch videos on how to properly lay your pad, like how to properly put it on the pants. That helps to allow it to fit well. Or you can the bigger pads. I know that um okay, moped their pads come in different sizes. So you can go for a slightly bigger pad if that's small, maybe the one you're using is too small and it's not properly working for you. I don't know if that answers your question.
It does. Thank you. So my next question goes to Esther. Esther, thank you so much for your presentation. I want to ask you a question concerning self-care tips. You mentioned that I should eat foods rich in magnesium, but I also noticed that there are some certain foods that I eat that worsen the pain. And most people say, oh, that is sugar that is really causing this pain. Is that right or wrong? Can you just expand on this, please?
Okay, so concerning the meals I mentioned that yes, sugar worsens the pain because insulin is produced, and excess of that can cause inflammation, which makes the pain a lot worse for you. So that's why I mentioned that you should eat foods that are rich in magnesium, like banana, nuts, and vegetables, fruits and vegetables, more of that during that period. Then you can take stuff like teas that are like plant extracts, like ginger tea, green tea. They help to reduce the inflammation or the pain around that period. I don't know if I've answered that question.
Okay, you have. Thank you very much. Does anybody have any more questions to ask? Okay, this is the last question. So, dear Tosin, last year my friend was diagnosed of premenstrual syndrome, and she was told that it's a psychological disorder and that she is to see a psychiatrist concerning her issues. I'm just wondering, since most females have mood swings, why does she have to see a psychologist? Why can't she just stay at home and just keep managing herself the way she is?
Okay, thank you for that question. So, um, I'm going to assume that the doctor that examined her had taken a proper history. So, firstly, if her premenstrual syndrome is just only when she's about to be on her period, that means that one is linked to her hormones, yeah. But if it is that it is sustained even till after her period and it continues like that throughout the month, she's still having like those mood swings, then I think that's probably why she had been advised to see a psychiatrist. Or I don't know if that answers the question.
Thank you very much, Tosin. Ambibola is raising up her hand. Ma, please, you can go ahead.
Okay, good evening, ma'am. My question is that of recent, I was supposed to have made this by 15th, and I've been having delay at it, and I've been having bloated stomach lately. Is there any advice to it?
Okay, so first of all, I just want to know, what's your cycle length like? Do you know your cycle length?
Yes, from 15th.
No, what I mean by cycle length, do you see your period the same day, every single month, the same date?
Yes, yes.
You see
But
it on
this
the
month
same
has been,
date, has been a bit
yes, ma'am.
different. Okay, so my name is Victoria Duke on the group, on the YSB group. Please, you can text me privately so we can continue from there.
Okay, because
Victoria Duke, thank you. I'm the one, yeah, so you can. So thank you so much,
okay.
everyone, for coming. Does anyone have any other questions? Does anybody have any other questions, please?
Yes, I do. Yes, I
Okay.
do. Um, and I will still chat you privately. What causes my period to be less than 28 days? Because now I feel like it's shorter. It's been shorter like since maybe 7 months now. For the past 7 months, I see it every 24 days or 21 days. I don't know, but it's not up to 30 days. Before it used to be up to 28 days, but right now it's very short.
Okay, thank you so much for that question, ma'am. You can actually still chat me privately, but I just want to state this so that everyone else knows. So it is possible that your cycle length was 28 days before, but then it either increases or decreases. But we don't really worry unless it now becomes less than 21 days or more than 35 days, as long as you are not sexually active. So let me just point that out, because usually females will come and tell you, okay, that they used to see their period every 15th of a month, and then they're not seeing it, and they've not seen it. And today is, let's say, for example, 19th. That's why reason why I'm telling everyone that everyone must download the app. I must show it on the group that they've downloaded the app. So you'll be able to know your cycle length. As long as you're not sexually active, we're not completely worried. Do you understand? So unless your period length now increases greater than 35 days, but then like, what's going on? something is definitely changing in your body system. But Mrs. Ifoma, may you can please just text me quickly on WhatsApp, so that's fine. But anyone else have any questions? Is that all?
Well, yeah, thank you very much.
Okay, so um Pinanita, you can now take over.
All right. Please let's put our virtual hands together for all our doctors and nurses that talked today. Please let's tell them thank you. I learned a lot actually. Thank you so much, YSB Medics. Coin Solar, your hand is up.
That was a mistake. So sorry.
Okay.
Yeah,
Okay.
thank you.
All right. Thank you so much, YSB Medics, for hosting this session, and hopefully we'll have a part 2 because it's looking like we have certain issues that need to be addressed when it comes to periods. I think that it's a very inexhaustive topic. Thank you so much, everybody, for coming. Please, as Dr. Vicky has said, let's show our proofs on the group by sharing our calendar. Yes, I personally I use the Flow app. I don't know, is that example of what we're supposed to drop, Dr. Vic?
Yes, please. You can just take a screenshot of it on your screen, on your work, on your homepage. You don't need to open and show us. That's private business. But yeah.
Okay. All right. Thank you so much. So I'll just end with a closing prayer. Father, thank you for tonight's session. Thank you for everything that we have learned. And we also ask, oh God, for healing and divine health for every YSB queen. We ask, oh God, that the changes in our bodies would not make us sicker. It will not paralyze us. It will not make us stressed. In the name of Jesus. Thank you, Father, for in Jesus' mighty name we have prayed. Amen. Amen and amen. Thank you, everybody, for joining.
Thank you
And
everyone for joining.
subs. Have a beautiful night's rest, everybody.